you're listening to, you're seeing hope on the worst conversation you ever want to have.
Every day you wake up and Michael Scott goes, I'm ready to be hurt again. Like that's what you walk into every day.
And you talk about a purpose. Almost 18,000 people every day come to work to take care of almost 18,000 people.
The youngest person on that accounting team to the CEO of Community Health Network. What is one piece of advice you'd give to young leaders in Indiana? From South Bend to Evansville and everywhere in between, this is Get In, the show focused on the Hoosier State and the incredible stories happening here today. I'm Nate Spengel, founder of Get Indiana, and I will be your host for today's conversation. GetIndiana.com is your one-stop shop for everything Indiana, from festival and event guides to blog posts covering hidden gems, local businesses, small towns, and more. Check it out and learn something new about the Hoosier State at GetIndiana.com, and don't forget to subscribe to our weekly newsletter right there at the top. My guest today is Bryan Mills. He has spent over 40 years at Community Health Network. He started back in 1985 when he helped open Community Hospital North, later served as the CEO of its for-profit affiliate Visionary Enterprises, Inc., and ultimately became president and CEO of the entire network on May 1st, 2009. He's a graduate of Ball State University. He has his bachelor's in accounting, and he has been honored by Ball State with its President's Medal of Distinction, the Accounting Lifetime Achievement Award, and the Distinguished Alumni Award. Today, we're going to be talking about his 40-year journey. Fun fact for everyone, December 31st, 2025 is Bryan's last day. He is retiring from Community Health, and we're going to just dive into this 40-year journey and the incredible impact that you've had on healthcare in Central Indiana and your journey. Bryan, welcome to the show.
Hey, thanks, Nate.
I'm excited about this one. This is our first big health system that we've dove into on the show. So I'm excited to learn, and no one better to tell this story than you. You spent over 40 years. So I'm assuming when you graduated from Ball State, you wanted to get right into healthcare. That was what you were chomping at the bit to get into, right?
Not at all. I thought that healthcare were things you did anything to avoid.
Classic. Okay. So you end up becoming an accountant for Ernst & Whinney, which becomes Ernst & Young. And so you're working in finance. How long did you do that for?
I did that for about 4 years,
okay.
But I worked in hospitals.
Oh, so your customers were hospitals?
Yeah, when I had an internship there, and in one of the internships, they sent me to Gary, Indiana, downtown.
No way. This is 1981. Okay.
And I fell in love with healthcare in Gary.
What made you love it?
So I tell people every Monday morning, I welcome people to our organization to go to new employee orientation. And what I tell them is that I don't know anything about healthcare. Nobody in my family was a doctor or a nurse or anything then. We do now. Every morning, I'd park my little car, and a herd of people would walk in. And, they're going to work for their shift. And I could hear what they're talking about. And I didn't know any of them, but sometime later in the afternoon, you'd walk back out and there were the people talking about it. And the idea that people actually come to work to take care of people they don't know is just magic to me.
Yeah.
And you talk about a purpose. I just thought that was fascinating, that people really, this was their desire, this was their call. To go help people they didn't know.
And you were up there crunching numbers, right? You're working in accounting and finance, and are you living in Gary?
Well, we were there so long. I was in hotels for a long time.
Oh, wow. So you're like having to go up there in person multiple days a week, come back, then go back up there?
Yes.
You end up serving healthcare customers. When do you end up making the switch, and what leads you to go and work at Community Health in 1985?
Yeah, I took the job in late 84. My boss took a job as a treasurer, CFO, for Community Hospital, the one on the east side.
So it wasn't a network at this point. It was Community Hospital out on the east side.
Correct. And he asked 3 of us to go with him. I was the youngest of the 3. And I asked him, what would I do? And he said, well, they're building this hospital in the middle of nowhere, which it was at the time. Fairbanks was there, but that was it. Fairbanks Recovery Center. And I said, I can't do that. I'm not qualified to do that.
Wait, when you say the middle of nowhere, you're talking about like Meridian or like 31 and I don't know what's the
Shadeland.
What's the?
It's just off of I-65, 69. So
Oh, yes.
It's 82nd Street and Shadeland Avenue,
Oh, that was the middle of nowhere.
middle of nowhere.
Okay, nice. So you end up going there and accepting that role.
I did.
How did that make you feel when your boss at the time thought enough of you to ask you to go along with him?
I really tried to talk my way out of it because I really didn't understand what this was all about. But I said yes because I trusted him. I trusted the other two people that went. They were a little bit older than me, but we worked as a team for what's now Ernst & Young.
And had it clicked then that you really enjoyed healthcare at that point in 1985?
I was glad to be in a hospital. I never thought I'd be in a leadership position.
Yeah. So you go and end up doing what for Community North?
Well, I was a finance guy.
Okay.
So I remember the first week or so, my boss came to me and said, "Hey, figure out how much cash we have, not just for North, but the whole thing." People listen to this know that you look at cash and how many days of expenses do you have on hand.
Yeah.
We didn't have a day.
No. So you got to hit the phones and say someone's got to pay their bills.
Yeah, and long story short, there was a bond that had been issued previously, and those dollars from the bond were in a bank account. It just wasn't on anything that we had.
Oh, so there was money somewhere.
So there was money, but we didn't.
Well, that's
know
just
it.
like getting everything in order. I mean, how do you feel? You're crunching these numbers and you're starting to see it. You're like, I just left my accounting job to come over here and we don't even have a day's of expense. Like the finance people always know what's going on with the business first.
Yes.
So you end up working your way up through the ranks of Community.
Well, kind of. I mean, it's not a normal path. I ended up putting together a medical management company for doctors.
Okay, explain what that means.
So the hospital was recruiting doctors. The doctors would come to work, but they really didn't have any business knowledge.
Yeah.
So, next thing you know, the CEO is saying, "Hey, we need some help. Can you help these doctors?" And of course, I've never done this before, but I said, "Okay, I'll try." And long story short, I ended up having a company, a subsidiary, Indianapolis Medical Management. We managed physician practices and provided billing services and hired staff and all these other things to allow them to still be independent.
Yeah.
And then the next...
And this was built under Community?
As a subsidiary.
Oh.
It was a new company.
Yeah, okay.
And then the next one was... and so we did that for a long time. And
so you're providing like the business acumen to doctors.
doctors.
Like this is like family,
Right.
family doctors who are like come out of school. They know how to like diagnose sick people, but don't know about billing and all that stuff.
That, and then we had some that we just did billing for them. But we put together this company to do that. And then the next thing I know, my boss came to me, the guy who ran Community North came to me and said, "Hey, Mills, what do you know about ASCs?" And I said, "I don't know what that stands for." And he said, "Ambulatory Surgery Center." I said, "Nothing." He said, "Well, figure it out. Because, we've got some things going on here. We need to maybe get into the surgery center business."
Ambulatory surgery centers. Okay, what is that
And
in normal person's terms?
they would be surgery centers, places where you will have surgery. It's
Like
just
outpatient surgery?
Outpatient surgery.
Okay, so you show up to get your, I don't know, whatever it might be. This is like orthopedic stuff?
That's one. I mean, it could be any specialty.
Okay.
Again, this makes
And
no
those
sense.
didn't exist in Community at the time.
They did not, and it was really not many places at all. So, there was a nurse who worked in the OR at North, and she'd been in California, and they were out there. So we literally hopped on a plane, flew to California, knocked on doors, took pictures, asked questions, and came back and put together a surgery center that still exists on the Community North campus.
So you helped create this, the Community Health's first surgery center?
Yes, and then many more after that.
Wow.
And
How did you feel like when the first patient walks in there to get a surgery performed at this new surgery center? How did that make you feel and like your team and the work you guys had put in?
I would say anxious because I still really didn't know what was going on. And one of the stories that I tell, Nate, is that at some point I said, I need to understand this business better. So I wanted to go watch surgery. I go in to watch the surgery. It's a high school football a quarterback, and he had an issue in his shoulder. And I watched, and I'm sitting down watching this, and all of a sudden, the doctor's knocking on this pipe to go through and open that up. And when that opens up, all this fluid comes out, and I'm going down. And a patient popped me. A nurse popped me in the chest and said, "Do not pass that on the patient." So we got through that. A few days later, I'm at another surgery center and we had several of these, because I'm trying to understand, what this is all about, so that I can be a better business person and advisor. I walk in the next one, and there's a high chair with a seatbelt on it, and I said, I looked at it, and they said, "We hear you're kind of weak," and so I went over there. I sat down in the stool, buckled myself in, and I said, "I'm here to learn."
No way.
And that's how I've learned healthcare. I'm not a very good accountant anymore. I can't even do my own taxes. But the whole thing was, I still think it's just amazing in our organization that we have almost 18,000 people every day come to work to take care of almost 18,000 people that they don't know. I still think that at its core is amazing.
So there's 18,000 employees
now,
and you see almost 18,000 patients a day?
Numbers are pretty close.
That's pretty cool. Every day, your 18,000 people come to work to serve almost 18,000 people. That's amazing. Where along the journey, I think this is a big qualm maybe with healthcare, is a lot of the providers get in because they want to take good care of people.
Correct.
And how do you manage running a business and providing exceptional care for your patients?
Well, I'll go to what I believe my real title is, and that's that I'm the Chief Cultural Officer.
Yeah.
That's really what I do.
Yeah.
So to try to put teams together to understand that we all have, there's a lot, it's complex. There's a lot of pieces here. Another story I would tell you, Nate, would be, I'll never forget the day 2 or week 2 of COVID.
Oh, yeah.
Okay. I'm in my office. My assistant tells me that there's a bunch of doctors on the first floor looking to talk to me, because we employed, over the years, doctors, instead of having their own practices, many have sold those practices, or people who are coming out of school want to just practice medicine. They don't want to have a private practice.
Yeah.
So we have a lot of doctors that we hire. And to be candid, I'm thinking, we're in COVID. We don't know what's going on. What the heck? What's this all about? So I'm kind of anxious, a little bit upset, as I'm walking out down to this foyer. And I looked at a physician, surgeon that I still know very well, and I said, "What the hell?" And he said, "What do you guys need?" And he said, we're not open. And he looked at me and he said, "Bryan, I know that. We all know that. But we're on your team. What do you want us to do? We can't practice." And on that day, we became one team, because doctors were helping with supplies, running errands, doing housekeeping. And it had nothing to do with being a doctor. They were just part of what we are.
Yeah.
And there's so many stories out of what happened there. But the thing about it was we became one entity, one team, and came together because all of us had a problem, and we had to figure out how to get through it.
Yeah. I think that's pretty cool. Especially like doctors, like being, okay, I might be a doctor, but today if you need a housekeeper, I can be the housekeeper. Or if you need someone to, do whatever, I'm here for that. I'm part of this team. Like, what was your title during this time?
I was the president of VEI. That's the entity that we have there. But we had also expanded. We had surgery centers in Michigan, Illinois, and we're running them because other hospitals had reached out to us to come help them do that. So wow. It was actually very fun.
Yeah, I feel like today, not a lot of people stay at jobs for 40 years. I don't know. I think the average tenure is 3 or 5 years or something like that. But to stay at a community for 40 years, but you got these different micro jobs or different individual challenges to go solve during your time there. That had to be pretty fun. What was Out of all the different things that you worked on, what are you most proud of from that time before you were the CEO?
Back then, I mean, a lot of these things we were doing where people were making investments. So these things were for profit.
Yeah.
So we're putting things together. We're creating something. We're helping people. People,
So you guys had like investors, like private investors?
typically physicians,
Okay.
because it's you get into a lot of regulation here.
Yeah.
But there's limited people that could do that.
What time frame? This is like what year?
This would be from about 1991 to 2005.
So you're like raising investment from doctors, physicians, and then investing that to create what?
Surgery centers or similar things that literally are a profitable entity. We did things with other hospitals outside of communities, so we were investors, they were investors. It was really something that was
This is not like running a health system.
No.
This is like you're this for-profit entity, kind of like almost innovation. Like you're building new things, and that's pretty fun.
yeah.
From there, in 2009, was your mentor the old CEO? Who's your mentor?
My mentor was a guy who was the head of the Indiana Gas Company. His name was Jack Heine.
Okay, so how did you get connected with Jack?
Just over the years, he was on boards, and I thought it was fascinating. He was a baseball player, and I was a baseball player. We became friends. As I said, that he didn't have children, so he was a mentor. He was a smart guy, and so I would pick him up, and we'd have lunch, and he was also someone who was just down to the earth, just somebody who really wanted to do anything to help other people. He actually served under Patton in World War II. And
No way. Jack Heine. He led Indiana Gas Company. Wow. So he becomes your mentor, and then in 2009, Community Health's previous CEO decides to retire.
In 2008, they came to me and I said, "Well, I like what I'm doing. I mean, I'm not interested in that. I don't know anything about that." And I was told to send your resume. Put together a half-baked resume and turned it in. And the board chair came back and said, "You can do better than that." So now I'm kind of ticked because I'm wasting time because I really don't want to do this.
Yeah. Why didn't you want to do it?
Because I loved what I was doing. Nothing. I mean, I was having fun. I was doing transactions. I was working with people. It was a financial thing that I understood.
And this was still, you guys are building these for-profit entities, doing, surgery centers or whatever that might be. Yeah, it's kind of like almost like investing, like venture capital type work, like business work, but you just happen to be in the healthcare space. That's pretty fun.
Yeah.
So you go back and you redo your resume and turn it back in?
Yes, I turned it back in. I went through the whole interview process, and then one time they at the end they wanted to talk to my wife, and Kathy and I just had our 40th anniversary.
Congrats!
So all this.
So this is all together. Like you've been.
Yeah, we've been in one team.
There you go.
And have a just amazing relationship. But there were two females on the board, and they wanted to have dinner with the two of us. So we get there, and they said, "We're here to talk to Kathy, not you, Bryan." So kind of keep your mouth shut.
Shut it. Yeah, classic.
And I'll never forget. They said, "So what are you, Kathy? How are you going to feel when he's never home for dinner? How does that? He's got things going on. These organizations never close. How do you feel about that?" And I'll never forget. She kind of paused, and I could tell she was thinking. She said, "Well, my best friend growing up was my dad, and I still love my dad. He's now deceased. But I can't think of any time that he actually was there for dinner. I think it's overrated."
That's what and you're like, "No, stop. Don't say that. I don't want this job." Wow. And so you...
But by that point, I did. I mean...
What flipped that switch for you?
It was just going through the whole thing and talking to other people. I was talking to other board members. This is what they were looking for. They thought I had the ability to do it.
Yeah.
And instead of just stiff arming it, I just said, "Okay, there's something here."
Yeah.
I'm anxious because I don't know what I'm going to do.
Yeah.
And I've never run a hospital, never run a clinic. I mean, all these things that you think about it, I just hadn't done that.
Yeah. And so you end up getting the job.
Yes.
And obviously from that moment up and to the right, all great times only. Talk to me about how things really went.
Personally, it was me trying to find, what can I do here?
Yeah.
You know, what is it that I can...
Like, what is the job of the CEO of a healthcare network? Like, what does that even look like?
I think people look at it different ways. Some people, I mean, you can go to school to learn how to do all this and run a health system or run departments or whatever it is. I didn't have that background.
Yeah.
So that's where, to me, it was culture. It was go through and try to identify what it is that we do. And part of what I've said was, what would you want for your family? What do you want for your friends? How can we put something together that is focused on not how much money you make, not how much of this or that you do, but basically trying to put together an organization that's focused on patients.
Yeah.
We as an organization have tried to go through, I've tried over this many years now, to say we need to have patients first in any conversation that we're having, and to make sure that we're putting our hands around ourselves, trying to say, okay, well, how do we help patients?
Yeah.
And which is really important. And second thing is that, and with that, I'm kind of jumping topics here, but years ago we had an oncology program that just wasn't doing much. And long story short, I ended up doing some research and try to figure out what's the top oncology place in the United States, actually in the world now. It was MD Anderson in Houston. Yeah. So I cold called Houston and said, hey, I need an oncology. I'm having trouble up here. Can you help me somehow? And bottom line is, we put together a partnership with them. We follow all the things they do. The doctors, learn what they're doing, what we're doing. We come together as a partner, and they have 6 partners in the United States, and we're one of those 6.
No, that came from a cold call.
It's call from a cold call, and all the others are academic medical centers. We're not.
You cold call the #1 oncology department.
They came here. I mean, this happened over a long period of time.
Yeah.
They had a program for people that wasn't at a lesser level than this partner. And so we were in that for a long time. And then they decided about 2 years before COVID that they weren't going to do that anymore. So I talked to the CEO and said, hey, I know there's another level. Can we try to achieve that level? And he said, well, nobody's ever done that. I don't know if we can or not. I'll get back with you. And they said, okay, we'll give you a shot here.
Yeah.
But it's really detailed, because it really is, how do medical oncologists, provide services to patients, and how do nurses and everything else do it? And they said, okay, we'll give you a chance. And
Wow.
And we made it.
Was it hard for you to flip the switch in your head coming from the profit side of healthcare? Like you're working in the for-profit entity, you have investors, all that stuff, and then switching to, hey, we're keeping patients at the center of that. I just feel like this is a really hard part with healthcare, is balancing profit and patient experience.
I think I changed when I was in the for-profit side. That was my responsibility to create that. As I transitioned to running a not-for-profit healthcare entity, you really get into mission. You really get into what people need. And I just personally believe that when you take on that mission, we're here for everyone.
Yeah.
And this is not about the who's who or anything along those lines. It's that I believe that from my perspective, everyone should have access to great care.
Yeah.
Everyone should have people treat them respectfully.
Yeah.
For whatever's going on. And the questions should be questions that people respond to. And it's putting together a team that really wants to put patients first and make sure that their experience is fabulous in what they're doing, regardless of who they are, what language they speak, where they came from, what their issues are. Those things, to me, back to your last comment, that drives me more than finance.
It's always interesting to see providers, they get into this, they become physicians, they become specialists, whatever that might be, because they want to take care of people. And then you realize it's like, well, like it still has to be a profitable business, like you have to figure out how to balance the scales there so that you can afford to give the highest quality of patient experience to the most people and also pay all your staff. Like that just seems like a really hard math equation to really dial in. So kudos to you for, taking that on for how many years? 16? You've been the CEO for 16 years.
Right.
How have you seen community health change over your 16 years as CEO?
The idea that we ended up hiring physicians and nurse practitioners and what have you to be a part of what we are. There are still a few doctors that are independent, but it's really changed over time. A lot of it's just the complexity, the regulations, the cost of electronic medical records. All these things have made it very difficult to do that on your own. And so we've hired a lot of physicians. But one of the things that we do when physicians come to our organization, we have leadership programs from them. If you're a physician, you probably didn't have business classes. You didn't do all these things. You were focused on science. So we run cohorts of people trying to make sure that you are a good leader, and that's helped a whole lot. Mm-hmm. And then with the cost of setting up a practice, the cost of electronic medical records, and all these other things, most people who graduate, the majority of them want to work for somebody. It's really changed.
How big is community health today?
It depends on what you. How
yeah,
you
like
look at
you
it.
said 18,000 employees, right? Like roughly.
Yeah, total, and they're not all full time, but that's the head count.
Where are those all spread out to? Like, what are the different things and entities and like the footprint of community health?
They're in hospitals. They're in clinics.
How many hospitals do you have?
It depends on how you look at a hospital. It's somewhere between 8 and 10. So but facilities. But if you look at campuses, we have campuses on the north side, east side, south side here, Kokomo, Anderson. I mean, those are our large campuses.
Yeah.
And and like the Kokomo, South, Kokomo, Anderson, these were places that were not financially strong. So that's why we absorbed them and brought them in.
What did you have to take over all previous healthcare hospitals?
Yeah.
So what was the hospital on the south side?
It was University Heights was the name of it.
University. And then what was one in Kokomo?
It was Howard Regional.
Howard Regional Health.
And then Anderson's Community of Anderson.
Okay.
But those were
they were independent. Was this before your time or during your time?
During my time.
Okay. As CEO?
Mm-hmm.
So take me through one of those. So do you get like a call of like, hey, things are looking a little bit bleak over here for the future of this county hospital. Like we need to talk. Mm-hmm. That's how it goes?
That's how it goes. That's how it starts. And
like like the old CEO calls you? Like take me through like how that is it a transaction? Is that what you call it?
Yes, it would be a transaction. Yeah. And the call did come from the former CEO. And they weren't just calling us; they were calling other people.
Yeah.
And they're looking for, because a lot of these are a lot of the county hospitals literally were started by the county, owned by the county.
Oh.
But they have obligation to that. And if you go through like a Kokomo, and I'm not being mean-spirited here, but a lot of bad things happen in Kokomo, especially in automotive, for a long time.
Yeah.
And next thing you know, you got a place that's thriving. I still go back to my high school years and playing ball, and when you went to Anderson and Kokomo, you're going to get your butt kicked.
Yeah, right. Like there was a lot going on. Yeah, for sure.
And it was year round and summer leagues and all these other things. I mean, they were just places that were huge, and then they weren't.
Yeah.
But the people are still there.
Yeah.
And so it really is, okay, how can we come together and take things like our mission, vision, value, and say, how do we work together?
Was there like a time frame where they're like, hey, things are not going well here. Like if we don't figure out the next evolution of this by the end of the year, like we're going to have to close up shop.
It's not quite that direct. It really is trying to go through and see what can you do to help us without giving up control.
And are like other health systems pitching as well of like, hey, we want to make this, IU Kokomo or whatever, like what does it come down to? Like through those 3 transactions, what wins that bid, I suppose, or what makes that a good fit for you all?
Those things change over time. You know, what immediately happens and what happens in the future change.
Yeah.
But it really is trying to have us take on the mission.
Yeah.
It really, people get caught up in the business piece. You're doing this for a return on investment and everything else. I mean, I would say basically what you just said, that's just not what it is. We believe that in the mission of not-for-profit hospitals, that we're there for the county, for the citizens. That's where the dollars go back to. Yeah. It's not like you're going to buy something and, make it better and sell it to somebody else. That's not the purpose of what we do. Yeah. So it's trying to get in there. Can we get the culture together? Yeah. And sometimes it ends up happening. You've changed leadership, because those leaders had a different calling. We've changed boards. We've changed the amount of authority somebody has locally versus for the network. So they're complex, but when it's all said and done, if we can all take on the responsibility of providing the best health care for the citizens, no matter where they are, then we're going to do it. It's like Westfield. Okay, we're building a new hospital in Westfield, first one new since North in '85. We have not built anything new. We've taken over things, we've redone things, but we have not done anything new, and it's 40 years later. Wow! And so that's an area that we believe it's growing amazingly quick. Yeah. And so we're under construction, and
so you guys end up taking over the Kokomo, the hospital up in Howard County. That's not. There's a reason that it's not working for them anymore, right? Like clearly, your business, correct, is probably losing money or something like that. So why does it make sense? And how are you able to turn that around and fix that and make it a thriving hub for healthcare?
Well, I can't say this for all businesses because I don't know all businesses, but you have assets that need to be replenished or changed. Yeah. You have a staff of people. And maybe we don't need all that staff for what we're doing in that location. Are there opportunities we're not allowed to take care of, that they can't take care of because they don't have the resources to do it? How do you get the local community involved in what that is? Yeah. And then you take things like computers and electronic medical records. I mean, those things didn't exist for a long time. They exist now. And the one we use is a really good one, but it's expensive.
Yeah. And so then you can fold that into your larger, plan or whatever with the bigger,
And then we can also recruit physicians there, and maybe they're there part-time and back at another place part-time, but it's trying to put together, all the components to say when it's all said and done, it's got to thrive. I mean, if you looked at our bottom line margins, they're not much, but we pay our expenses, and we have a little bit to put in the bank, but it's not flipping a switch, and it's not trying to find the bad guys. It's trying to say, okay, can we agree upon mission, what we're all about, and do that? And and I would say in the Anderson and Kokomo towns that have had some tough times, we're doing a good job.
Yeah. What's the hardest job at a hospital?
This probably isn't a direct answer, but I'm still admired by people who provide direct care. I mean, it's a calling. I mean, I can't do it. I mean, I've been around a long time. I could not do it. Yeah. I mean, to understand what people go through for years to learn how to do surgery or cardiology or anything.
It's amazing, right?
I revere physicians, but I tell you what, the nurses and the people doing that direct care, that calling is amazing. That calling is said, I'm here to do anything. These are people that they'll walk through anything to take care of a patient. These are tough people.
I would always anyone who has to deliver bad news, let's say surgeons are, performing whatever the surgery is, but whether it's a doctor or whoever that has to be hey, you have this terminal illness. Like that would be so hard to do day in and day out.
So two things come to my mind on that. One is we decided years ago on every one of our campuses, there's got to be somebody who's the top. Okay? Somebody's got to be responsible for everything going on those campuses. And we at Community decided that that would be an RN. It's been a really good decision.
That an RN would be at the top of the campus. Like what is that role called?
The chief nurse executive. I mean, that's what we call the top person there. And the reason is when chaos is going through and you're trying to figure out what you do, which lane do you get on, the nurse is going to do what's best for patients.
Yeah.
That's how they're made. That's how they roll. And that's been a really good decision. So it's not saying finances don't mean anything, but it's very important that they do that.
I mean, kudos to them. And yeah, that would just be like, I get to sit in here and talk on a podcast, and it's like, I can't imagine having to go out and have multiple conversations in a week, delivering some of the hardest conversations. You know, like, think about that from a provider perspective. Let's say you're in oncology and, you know, let's just say, I don't know the numbers, I'm making all of this up, but 5 times a week, you have to tell someone that they have cancer. It's like, that's the biggest conversation in their life. Like they have probably never had a bigger conversation than that. And you've had 5 this week. You know, that's heavy.
So you picked the right one.
Yeah.
Okay. We all have been either don't want to hear that or we've heard it and have seen it live. So when we became a partner of MD Anderson, and we had this big gathering, and all the people from Houston came here, and we're here, and we're celebrating this. Our number one medical oncologist stepped up to the microphone, and he said, "If you get a cancer diagnosis, we will see you within 48 hours." That's factual. That happens. And I sat there and I looked at him. I'm thinking, oh my gosh, because I can't make that. I can't say you will do, and I probably wouldn't have, but that's what he said.
Well, yeah, because you got to think about the stress of that. If someone says, hey, your test came back, you have cancer, you're like, oh my God, how do I get this fixed immediately?
Yeah.
And you're like trying to beat a clock too there.
And what's the plan? So the idea is that come have this conversation, bring your family, do all these things. And we have, it's surprising the number of people say, I can't be there in 48 hours. Okay, that's fine. When can you be here? Let's have a conversation.
The soonest you're available to come.
Let's go through this process. And it just kind of de-escalates what's going on and what's next. Yeah. I mean, but I've had many, many people who've said, I can't believe it, Bryan. I mean, that happened. And now we've got other specialties that are saying the same thing. And people say, well, Bryan, how do you make that happen? I don't make any of that happen. It's because as a culture, this is what we believe in. We are community here for the citizens of our community.
Talk about hard conversations, right? Like you get that hard conversation, a diagnosis with cancer, and you guys are stepping up and, within 48 hours, you're giving them the option to be seen there. What have been hard conversations that you've had to have?
There's been a few. The ones that come to mind, Nate, would be, people that have been good friends and people that I still want to be friends with just weren't doing what they should be doing.
Oh yeah.
And so we need to help them find a job some other place.
Yeah.
And that's hard.
How does healthcare staff and healthcare systems, what's the scoreboard? How do you know if you're good or not good at something like at a job like a doctor?
I would say better. I don't know if that's the right word, but at least we have data these days,
Like what's the data you're looking at though? Like if we had 2, let's say family doctors, how do you know if one is excellent and one is not excellent?
We have analytics. We have, information that we send out to patients or companies to try to get their input. We didn't have that all the time.
Yeah.
I mean, it's no different than being in an airport or a ball game or any other industry. We've got these data that we get, and we get, we ask for people for feedback on all these various things. And I think sometimes they feel like it's, you're just peppering me, but we really are using this information. Yeah. And we have hundreds of thousands of data points.
Yeah. Well, I guess like when you were sitting there and you're looking at, whether some sort of provider, like what are the and are you allowed to talk about like the indicators where it's like, hey, so-and-so's patient satisfaction score is X. And like, what is it like knowledge? Like one, I'm assuming is like knowledge of medicine. Like you need to have that. And then like customer interaction, customer experience, like not being a jerk. Like, I don't know, like what goes into it?
Well, first thing that comes to mind to me is and this isn't a direct, but I'll get to what you said, is that, you want to have a conversation with the patient. Okay, don't be have one foot out the door.
Yeah.
Sit down, talk to them. Let's go through what we're trying to get done here. What's the plan? That's part of the reason of doing these leadership trainings for doctors and advanced practice nurses and everybody else, is going through and say, this is what it's all about. And I think that's changed in healthcare over time. I think it's a good change. I think it's good that we have data. It's good that we can actually help people. I'll just say this. I mean, we've done this for hundreds of physicians to go through this program about, what's it like to be a leader. And you're doing something right when I've had calls and letters come in from spouses of physicians who've made comments like, thanks for giving me back the person I fell in love with. Now you hold that piece of paper and look at it and think, what a sentence. Because at some point in time, that doctor, he achieved that. He didn't go to business school, or she didn't go to business school. They didn't have all this. They're trying to get through something that is really hard to get in and really hard to get through.
And that is another piece of it. I do want to know, like, yeah, you're talking about leadership training, but like when you're looking at, like, if you had to look at a health system and find the number one doctor, I know that's going to be really hard to do, but what kind of values, what kind of characteristics, what kind of things would make up the greatest doctor in a health system?
I mean, the outcomes are obviously is something you can't put aside. So whatever's happening, what are the results? And we have a better way to looking at that.
Oh yeah.
But
see, I didn't even think about that, because I guess like when you're not around healthcare, I just kind of like just assume that whatever any doctor says, like, I feel like I have this, like, every doctor is all knowing, like they all know how to fix exactly the problem that I have right now. And it's like, well, there's still levels of how much training and experience and knowledge and specialty and all of those different things versus like every doctor knows everything about the human body always. That is interesting. So outcomes.
Well, first of all, we have data. Okay.
Yeah.
For years, people kind of made up why they were good. And I'm not saying they were wrong, but we had no data. But
well, it'd be like, I would rank it on who's the friendliest, nicest, easiest to talk to doctor. Like that one's the best.
Right. And so with all the things that we do to analyze what this is, I think for a long time there was kind of a, stiff arm that like, this isn't part of what I do. But the physicians have come around and said, and their APPs as well of saying, hey, this is important. Because the whole point is, I want to make sure that people receiving care are care that we would provide for our own family. That should not be a separation. And so it's going through and figuring out how to do it. But so much of it is that even as you have information to provide, sit down, talk to them. This is not you're bad, you're good. This is about how do we get better? Because this is a we organization.
I think it would be hard. You talk about like the letters you get back from spouses. A doctor or any sort of these providers go in there, and the emotional and psychological aspect of like having these tough conversations, or like when you work in a certain field, like not everyone is going to make it,
Sure.
Like, I don't know what the number is, but you think about everyone, I feel like knows someone who, I feel like every person in America knows someone who has lost their battle with cancer. And you talk about like multiply that out. Like outcomes aren't always positive. And that would just be so challenging to give yourself to that. And like every day you wake up and you walk into the door of the hospital and you're ready to just like, I'm ready to, it's like, have you ever seen The Office? Mm-hmm. And Michael Scott goes, I'm ready to be hurt again. Like that's what you walk into every day. And like try to find positive outcomes and try to find some optimism, man. Like that would be challenging.
I agree with you. But what goes through my mind, and nothing against what you said. I'm not saying what right and wrong, but I get to what goes to my head is suicide.
Yeah.
And how could we prevent that?
And is that like something that's prevalent in doctors?
It is higher than most other professions.
Yeah.
As an organization, here we are in COVID, and we've had Fairbanks Recovery, Fairbanks Addiction Hospital has been on the North Campus before Community North. And we had a good relationship with them, but we actually acquired them during COVID.
Yeah. What is the Fairbanks Foundation?
It's a hospital for addictions.
Yeah.
That's it. That's all it's done.
A hospital for addiction.
And then there's all things, outpatient and therapies. But it couldn't make it. When you think about all the addictions that we have in our country, in our city, and all of a sudden something that's been here for 80 years, cannot survive. And so I think those are also the things that this kind of get kicked in the corner sometime. It's kind of like those people. Well, addictions of a number of things. I mean, it's not just alcohol or drugs. I mean, there's all kinds of things, especially in society. And you go back to all this data and everything.
Well, it's never been easier to be addicted to something. Like we live in the world of excess, and it's easy to get hooked on. Oh my gosh, tons of stuff.
So we acquired it. That's where we had a relationship. But we now work with organizations to produce more people to do this, to help it. But the addiction, the mental health, behavioral care addictions in our state and most every state are just undersupplied.
Yeah.
And so those are the things, because and I'm still saying, I'm not saying what's one or two or three between this and cancer and anything else, or a baby in a NICU. I mean, all these things are very, very difficult. But I think it's important that we, as a society, address all of these.
Yeah. Is it hard to context switch like that? Like you're leading this organization, and one moment you're talking about how are we supporting the most amount of kids in the NICU, and the next moment you're talking about how are we taking care of our aging and elderly community, and then the next minute you're talking about emergency car crashes, like people coming in from there. Like that's a lot of different priorities and different just like hats to wear.
It's just a group of people. I'm assuming it's similar to other places. I only know one place I've ever worked at. But these people, they're wired for it. I mean, it's amazing how calm the providers are, the nurses are, the therapists are when something's going on. It is just amazing to watch.
Like, have you ever witnessed that firsthand, where there's like pandemonium, like where you like look from the outside and you're seeing pandemonium ensue, and then like as you really start to break it down, providers are cool, calm, and collected?
The story that comes to my mind when you said that is during COVID. We all did. Everybody was in office, said, "Get out of your office. You can't do anything. Go volunteer." So we all went to places, and I worked in an emergency room, first time in my life. Okay.
What'd you do?
I was a runner, to take things back and forth. One of them, the lab wasn't working, the thing, so I was running to the lab. What I was amazed is the people in there, they're calm. I mean, they're doing what they're doing. They are so calm, it's amazing.
Yeah.
And I remember being in ICU. And there was a couple codes because you hear what's going on, and after a couple of codes, I talked to the doctor and he said, "Bryan, this isn't TV," and that seems kind of simple, but to me, it gave me a chance to be live in all these things going on, like back to the surgery or anything else. I don't know how you coach. I feel like I'm the head. I describe myself as the head coach of the team. That's what I do. That's what my job is.
Yeah.
You can't be a good head coach unless you understand who all's on that team, what's their role, what's good about it, how do we train people. That's what this is all about.
Yeah, and how they're each motivated, how you can inspire them, and their roles within that org. That's
where I get my can't wait to get to work every morning. We're a team. I'm trying to coach my team best I can, but I've got to learn, and I've got to be vulnerable, and I've got to be willing to go into places that I'm not comfortable in.
40 years with community, which is wild. Like, I think anyone that stays anywhere for 40 years is wild. When you look back at your time at community, and obviously as people within the org are going to listen to this episode, what do you hope they learned or your legacy at Community means to those still going and carrying that mission on?
I would hope that people understand that I really care about them.
Yeah.
I want that when people call and want to talk to me, I walk the floors a lot of the time. I go to other places, and it's just to make it real that people understand that. First of all, the first thing they say, "But you're pretty small." I said, "All right, here we go. We are." Yeah.
Thanks, appreciate that.
So that's it. I mean, but to have those conversations, I eat lunches in our cafeterias. I mean, people come, can I join you? That's a great feeling.
Yeah.
That somebody wants to sit down and get to know each other. This is really, we get in a hierarchy. I think we have different gifts.
Yeah.
But we have one common mission.
Yeah.
And that's to deliver this care. And I hope that's what anybody sees, because we get distracted by how much it costs and what's going on with the debate on this or that. Oh, that's just part of the job.
Yeah.
Okay? Don't like it that well, but it's part of the job. But the real thing is we are here because we care for others.
The new CEO coming in is Dr. Patrick McGill.
Correct.
Obviously, I'm sure you've had this conversation, but what's the advice that you have? He's taken over Community Health Network starting in 2026. What would your advice be?
I don't pick my successor. I don't even have a vote on my successor. I do have an opinion.
Yeah.
And our board, when they're going through this process, I said, look, I realize I have nothing to do this, but if I were doing it, I would have the person succeeding me would be from within and a physician. And I think the physician piece is really important of that.
That's interesting coming from someone who doesn't have the physician background. Why do you think it's so important for that?
Nor could I've gotten through school to be a physician.
Yeah, you and me both, man.
So I think it's important because we as a business, as a state, look at the cost of care. We look at all we spend so much time talking about these things. I hope that we can change the agenda to talk about Hoosiers and health and issues and education and all these other things that we work on, because what we often we're dealing with what the outcome was. Okay, so it's saying, okay, can we change our conversations to talk about how do we make Hoosiers healthful? How do we get people through education? How do we get people out of poverty? How do we do all these things that the end result in much of this is what we see every day? Yeah. So I'm not pointing fingers at anybody. Yeah. I just want to change the conversations.
Like, as you were the CEO of Community Health Network, what kept you up at night?
Something that I could have done better that day or that week. I mean, but it changes.
Well, I just didn't know if there was like the underlying fact of we need to make people healthier. There's this whole talk about preventative measures versus responsive, and just in general, I think people are starting to take care of their health more or take care of their body more seriously. Maybe it's just all over Instagram and all over social media where people are pouring into the gym and this skincare routine and this, that, and the other thing. But it does seem like there's a wave of people realizing that, what you eat, how active you are, all of these types of things are important. I didn't know if just the general state of how healthy Hoosiers were.
Yeah, the data means a lot to me.
Yeah.
So I agree with you wholeheartedly what you just said. But I would segregate this from our population. And how do we make sure all of our population has this? How do we get people out of poverty? How do we give people purpose every day that they want to go to work as much as I want to go to work? How do we do this? And at that same time, have more manpower, have more people looking to work. I mean, I think we've got some red lines that we just kind of include some people and we don't include this whole idea. Like when I go to new employee orientation every Monday morning, one of the things people is I found the place I belong to. I belong here. And have all kinds of people over the years. And I think that, and I hope that everybody in our organization feels that way. I'm probably not correct, but we got to figure out how people do. Why do you leave? So I just think it's trying to make the Hoosiers better, our state better, by looking at it holistically, as opposed to saying you're bad, you're good, not spending money here. So that's my 2 cents.
If every previous and current community health network employee listened to this exact episode, if every employee of community health listened to this episode, what would you hope to tell them? If you could speak one-on-one to each and every one of them, what would you say?
I would say, one, thank you for teaching me healthcare.
Yeah.
I've learned healthcare through the eyes of people who do work.
Mm-hmm.
Thank you for having the courage to reach out to me when something was going wrong.
Yeah.
I've received a lot of things over the years. Okay. Everybody had the courage to tell the truth.
Yeah.
Never was it investigated and it was a lie. So, and thanks for your patience to allow me to come in your areas, to talk to you, have lunch with you in a cafeteria, because we're just people. We just have different gifts.
Yeah.
And when we come together, we can be one heck of a team if we just really respect one another.
What's next for Bryan Mills? You're retiring from your time at Community Health Network after 40 years of service. What do you do now?
I've had this conversation or that question several times, and are you gonna work? Are you gonna do something else? You're gonna write a book? You're gonna, and I've said no. I don't. I'm not gonna do any of those. I just really want to be a much better grandpa.
How many grandkids do you have?
We have 4 right now. 5th is on the way. I make it to some events here and there, but I'm not very reliable. You run an organization that never closes. You got responsibilities.
Yeah.
And like I said, my wife has understood that for our 40 years. But I really want time with grandkids. And my dad, that's what he did when he got so ill he couldn't work anymore. And he became the place where the grandkids went because they knew that he would take care of them. Yeah. And so I want to do whatever I can to be a much better grandpa.
Yeah. It's interesting. A lot of times people in the healthcare space or, any of those where you spend all of your time serving other people's families, that sometimes, your family ends up coming in and get the short end of the stick at times because, the organization never closes and these people need care. Almost 18,000 patients every single day. I think that this is well-deserved grandpa time, 40 years in the healthcare industry. No one's going to bat an eye at, Bryan taking some extra time for you and your family and to be a grandpa. I think that's so cool.
Well, they gave me the greatest name for grandpa that I've ever heard. They call me G-Daddy.
G-Daddy.
How about that?
That's a good one.
That's the coolest I've ever been.
I've never heard that one, but G-Daddy, that's a good one. This has been enlightening. I have one final question about just healthcare in general in the state of Indiana, and then we can just talk some more general things about Indiana as we wrap up. If you could wave a magic wand, and you could fix one thing with healthcare in Indiana, what do you think the number one issue is that you would fix with a magic wand?
I'd feel a lot better if we took your question, went upstream, tried to address this through business, through legislation, through education, and to say this is how we want to do healthcare in Indiana. Unless we look at it holistically, we just we're the circus clown, just kind of pop the next thing that shows up.
Yeah.
And I just think that people think that they have the easy answer, and I don't think it's an easy answer. But good things, good decisions take a lot of time and data. And even now, right now, we can't even agree upon the data. We have to have a single source of data.
I do think it's super complex, and it's an unfortunate time where it does seem like everyone can point out what's wrong and places where they wish it was different, but it's not always the most solutions coming to the table of how to make it any better. It's more of it's too expensive, it takes too long, it's this, it's that, it's a lot of negativity. I can never see, it's like whack-a-mole, right? You're talking about this problem comes up and you put it down there and then you go work on the next one and then another problem pops up here, and That'd be challenging. So kudos. I do want to say thank you to all. I'm sure that some providers and healthcare workers are going to listen to this one, and I commend you. Like, it is not an easy job. It's one I could never do. I think that people that wake up every day to serve others and to serve patients, some of which, again, we talked about it, at your lowest day. Like, I still remember having the conversation with when my mom got diagnosed with cancer, and the doctor comes, and I'm just like a kid. I'm like 20 years old.
Wow.
And she pulls me out into the hallway and tells me that my mom's cancer has spread to her brain. And like, that was a horrible conversation for me to receive. But imagine having to wake up and go and tell that to people every day. Like, your job is to, like, hey, we're going to try to put a treatment plan together and blah, 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 blah. But you have to walk yourself into those conversations willingly every day. Like, I only ever had one of those conversations.
And I didn't know that about you or your mom. I'm really sorry to hear that. And but the one thing that goes through my head is that so pancreatic cancer.
Yeah.
Okay, it's the death sentence, right? It's not. I personally know people who are still living, thriving because of what goes on here. You don't hear that. That's not. There are so many solutions going on.
Yeah.
That and hope is so huge.
Yeah.
And
I think that's an interesting piece too of, so my mom went through treatment up at Goshen Cancer Center up in Northern Indiana. And so much of that job working in oncology is having goals or like milestones to achieve versus just like, hey, this is the circumstances and like what happens. Like, them bringing in positive mindsets and positive vibes and like checking off, milestones like 9 months from now or 2 years from now, whatever that is. Like, those are just so important, and it can make a big difference, I feel like.
the lady who runs our foundation, I'm only telling you this because it is public.
Yeah.
Okay, Joyce Irwin. She gets pancreatic cancer.
Yeah.
She runs one of the things that she and her team do. We have this giving gig, this thing every year to raise money for cancer patients. So she ends up with that diagnosis. And I would never say this if I didn't have permission from her to say it. I would never do that. But I said, Joyce, and she had work, some of it here, some of it was Houston. So when we were going to have our giving gig after that, I said, Joyce, you got to tell people. She said, they all know. I said, no, they don't. They don't know can you sit there? And she sat there with another person, local person, I won't say her name, who had a cancer as well. And they told their story.
Yeah.
I tell you what, you could have heard a pin drop. But I also could feel people's, just heart just kind of going really rapidly because you're seeing hope.
Yeah.
On the worst conversation you ever want to have. We need to promote that. We need to bring it together. We need to make sure that people understand that's what it's going to do. And the people that I'm mentioning, they're still working. Okay. So
that's awesome.
So it's just I changing the message goes so far.
That's such a great point. I'm over here talking about all the negative outcomes. I didn't even think about talking about the positive ones where you get to say, people get to ring the bell, especially when when you see like a little kid walk up there and ring the bell. And
and it's so hard.
Let's go.
I'm going to yank it off.
Sir.
It is. It's there's a lot of good. And I think it's disproportionately good.
Yeah.
But we don't focus on that.
All right. We are going to talk all things Indiana now. We're going to round up the episode here. First question is brought to you by our friends at JC Hart. They are a leader in creating enjoyable living experiences at apartment communities all across Indiana and beyond. Check them out at homeisjchart.com. Bryan, my question for you, why do you call Indiana home?
My dad got transferred here.
There you go. That's the start.
So we showed up here in 1974, and I've moved a solid 1.5 miles.
1.5 miles since 1974. You talk about you went up to Gary. You probably could have taken career paths other places. Why have you chosen to stay in Indiana?
I never thought I would ever work in healthcare, and I've never felt greater purpose. It's really special. I was born in rural Kentucky. Then we moved to West Virginia, and I moved to Noblesville in '74, and I've moved a solid tenth of a mile since.
How has Noblesville changed since 1974?
Working on a farm with one of my buddies, because most of my friends then had farms or whatever it was, and the guy who owned the farm, my best friend's dad at the time, and he said, Millsy, you better go to school. You ain't no farmer.
That was back when Noblesville had farms and Westfield had fields back in the day?
Yeah, fields. So, because it, like Westfield, had one stoplight, as I recall.
No way.
Fishers, I don't think they had one. It's when I was in high school, Fishers closed. Fishers High School was closed.
Yeah. Wow.
And Westfield and
You better go to school. You ain't no farmer. Oh, wow. That's, yeah, you've seen it really develop and take off up there.
Yeah, and very good. I mean, just to, and matter of fact, I think the people that are making decisions up there really think about what they're doing. They're proud of what they're doing. Yeah. I know most of the mayors, and I'm just really impressed by them.
Mayor Jensen, he's a cool guy. He has a lot of energy.
He and I spend a lot of time together talking about the future. He's just a very wise thinker.
Yeah. You talk about spending more time with your family and your grandkids. When your grandkids and your family look at 40 years of service to Community Health Network, look at living in Noblesville, being active in the community, we didn't even get into talking about, oh my gosh, United Way and I mean all the other nonprofits and community service organizations that you're helping out. What lesson do you hope your family learns from your life thus far?
One, nothing's easy.
Yeah.
Two, you've got to get to know people before you make decisions. You just can't presume something.
Yeah.
And the other thing is that we all have been very blessed, and with that blessing is to give back to others and do anything we can. Not only money, but time.
Yeah. I think that's a big piece too when you think about as people like get higher and higher up the ladder of seniority, it's like, okay, I'll just write a check to that thing. I'll just give money or whatever. And it's like sometimes giving your time, just like those physicians, when you talk about getting in the room and making everyone feel heard and understood and all those things, like we can all take the time too to sit in there and, learn people's story and, do whatever the service that we're being called to do is.
Boys and Girls Club Kid.
Yeah.
In several cities, and still involved with Noblesville Boys and Girls Club. And I think that's a great place. I mean, you think about what it does. It takes children after school to come to a place.
Yeah.
And that place isn't just a playground. There's a lot of things happening there.
Yeah.
And I still think that is, I wish we had more clubs, larger clubs, more engagement in all cities, all states, because I think, and I'm not trying to, it's just, I say that because I know it, I'm a product of it.
Yeah.
I'm not saying there's not others that are really good as well.
Yeah.
But to me, that whole concept makes a whole lot of sense.
Of like, some after school type. Yeah.
You got that time, okay?
Yeah.
You're going to do something maybe good, but maybe you got to talk
Yeah, a little bit of free time to get into some trouble.
Mm-hmm.
We've all been there. Mm-hmm. Working your way up from the youngest person on that accounting team when you first started your career to the CEO of Community Health Network. What is one piece of advice you'd give to young leaders in Indiana?
Look at yourself in the mirror. Don't look at what everybody else is doing or what they have or whatever it is. Figure out who you want to be. And have the courage to ask questions, have the courage to raise your hand when you don't know the answer, but you're going to take that on.
Yeah.
And when it's all said and done, just remember, you can do more than you can do. We all need to be challenged. Challenges make us look at things differently, and also have the same respect for the person who comes to you or me and said, okay, here's where you were, here's where you are. How do you help me? I'm a mentor to a lot of people.
Yeah, I agree. I think one of the secrets to what makes your story so interesting, I don't know if it's really that big of a secret, but at every step, you had no idea how to do whatever you were doing. Like you had no idea how to run finance at Community North. You had no idea how to set up the billing and and like that first thing, and then the surgery centers, and then like it was just like, okay, but I know that I can figure that out. And I think a lot of people taking that risk that might on the outside seem risky, but like relying on your problem solving ability and the fact that the work usually shows yourself the way. Like people can usually figure out with time, research, the internet, talking to people, like picking up the phone. I totally respect that. I'm that kind of person too. If I had an issue with whatever it is, let's say the podcast, like cold calling or cold emailing or cold DMing the number one oncology center in the nation and in the world and saying, hey, we're having an issue. Do you have anyone that can help me? Like, that's so powerful. And I think people are like, oh, they're probably busy. Like, so many times I feel like you get to a certain level and people think like that those people no longer want to help.
Okay, so MD Anderson, I didn't know it when I called, but MD Anderson is literally a department of the University of Texas. I didn't know that.
Yeah.
I didn't know that they actually cannot own assets out of the state of Texas. So their way of spreading what they spread with us is by bringing partners in and train those partners to have the same protocol that you would get in Houston. Yeah. I didn't know any of that. Yeah. I just knew people say they're the best. So why wouldn't you try to no? And best, I mean, that's somebody's calculation, whatever it is. And it doesn't have to be that. It's like trying to find somebody that you admire or somebody who's been successful, because most people would love to share that.
Absolutely. I think that's a lesson that we could all learn of just like, a lot of times, especially Hoosiers, really willing to give back, and like, if they come and just ask like generally like, how do I be successful? Like that's a little vague, but it's like, hey, I'm having this issue with this specific thing. Do you have good advice around this topic? Like people will usually give you some feedback and at least help you avoid the landmines that they've stepped on themselves. Okay, as we round out, we have the same 3 questions that we ask every guest who comes on the show, all about the state of Indiana. So first, if you could shout it from the rooftops, what's something the world needs to know about Indiana?
IU is actually a football team.
we got to shout that from the rooftops for sure.
I mean that's and what a story. What an absolute story.
It has to be like the craziest underdog turnaround story ever. Like they were literally the most losingest football team in the country, ever. Using
what we've been talking about, why can't you take that? It's so visible. It's accurate. I mean, it's like, well, the math's not right. No, it is. They haven't lost, but really 2 years. But and say, okay, we can change things. Mm-hmm. I realize it's this team and do this. It's just it's a movie that you get to the end of and like, well, that couldn't have happened. No, this is not a movie.
If you went back a year, we'll just use sports analogies and say the Indiana Pacers are going to be in the NBA Finals. The Colts start the season 7-1, and IU is going to go undefeated in the regular season and beat Ohio State in the Big Ten championship. I would have said, sir, you've had a couple too many drinks, sir. Like this is a movie. Like what are you doing? And it's crazy. Like it's wild.
But that brings people together.
Yeah, and it does seem like Indiana is at the epicenter of the sporting universe right now. Pretty cool. The state of Indiana is, from the Fever to the Pacers to the Hoosiers to Purdue basketball, like sports runs through Indiana.
The basketball tournaments are here next year too.
Next, this is your opportunity to highlight something across the state that you really love and that needs to be getting more attention. What is a hidden gem in Indiana?
We've had a relationship with Ivy Tech for years for nurses.
Yeah,
I love that program.
The Ivy Tech nursing program. Yeah.
So most of these are students who have started life and decide they want to change their life. They come back through Ivy Tech and become a medical assistant, and then we help them get to be an RN.
That's awesome.
I still think that's one of the most magical things, and other things are happening at other universities, but to me, this is a life-changing
opportunity.
And these are people that are very busy, but they're going to go do something to change typically their family.
That's a gem. More people need to know about that.
That's my gem.
I love that one. Okay, finally, this is your opportunity to share the love. This is how we get guest recommendations or learn about other people in our state doing inspiring things. Who's a Hoosier we need to keep on our radar? Someone who's doing big things.
Like a Scott Fadness.
Yeah.
And you get Scott, Chris Jensen in Noblesville as well. But I know the things that, like Scott, how do you take where you are and make something bigger? How can you be so curious as about how we change this or that? So that would be one. Second one, selfishly to the community, is we've gotten to the insurance business. We are trying to make sure healthcare costs less. So we've put together these programs. We've got things going on because we're all talking about the cost of healthcare. And so we've said, okay, let's figure out how to do it. Yeah. So to me, that would be it's maybe a selfish gem, but it's not. Yeah. It's not just community.
Yeah, I love it, Bryan. It's been a pleasure to learn about 40 years of service to Community Health Network. It's incredible. Talk about the start at Community North, even though you didn't really know at first what you were doing and why you would be great at it. But in 2009, becoming the CEO and serving as the leader for the last 16 years. It's incredible. I'm honored to have gotten to share the mic with you and learn a little bit more about your story and the impact that you've made across the state of Indiana and beyond. Community health, doing great things. Congrats on all the success, man. It's because of people like you that the state of Indiana continues to thrive. So thank you.
Thank you very much.
All right, we'll talk soon. This show is made possible by our friends up at Sweetwater. Whether you're looking to start a podcast or take your content to the next level, click the link in the description to see all my gear recommendations at Sweetwater. If you want a behind-the-scenes look at everything we're doing across the state, make sure you follow me on Instagram and TikTok at Nate Spangle. Thank you so much for listening and being a part of what makes the Hoosier State great. We'll see you next time here on Get In.